Welcome to Zeo Skin Health webinar on exposure and aging skin, the damaging truth, presented by esteemed Zeo faculty member, Dr. Frederick Coville. My name is Noelle Denlinger, and I am Vice President of Global Marketing for Zeo Skin Health and today's webinar moderator. I am excited that we have hundreds of participants from all over the world joining the webinar today. From places such as Pleasantville, New Jersey, Richmond, Virginia, Venice, Florida in the US, and internationally, attendees from Sweden, Great Britain, and the Netherlands, and many more. In an effort to better serve our physicians and professionals, Zeo has educational seminars and webinars based on Dr. Zain Obaji's latest clinical findings and scientific thinking. For more information on upcoming events hosted by Zeo Skin Health, please visit the Zeo events page at zeoskinhealth.com. Before we begin, I have a few important points to review. First, all participants are muted for the entire webinar. Second, participants may type questions into the webinar chat box, and Dr. Coville and I will answer as many possible questions at the conclusion of his presentation. You may type questions anytime during the webinar. Lastly, this webinar may not be copied, recorded, reproduced, or distributed, as this material is the intellectual property of Cornerstone Plastic Surgery and Zeo Skin Health, Inc. I'd like to introduce today's guest speaker, Dr. Frederick Coville. Dr. Frederick A. Coville has been a plastic and reconstructive surgeon for over 25 years. After medical school, he spent his postdoctoral training years in his hometown, New York City, where he pursued his first love of surgery. This included a surgical residency at Maimonides Medical Center, and he served as chief resident in plastic surgery at the prestigious Mount Sinai Medical Center in Manhattan. Dr. Fred, as he is known to his patients and colleagues around the globe, also practiced at the exclusive and private Bougainville Clinic in the British Virgin Islands for many years before relocating to London with his wife. In addition to his surgical skills, he has gained particular expertise in his use of combined techniques for facial and skin rejuvenation. He is known for his innovative uses of mechanical, chemical, light, and injectables with or without surgery to achieve spectacular and natural results in patients of all skin types. Dr. Fred currently lectures extensively on a wide range of topics around the world and is an active consultant to the healthcare and aesthetic spa industry. He is a dynamic, clear-thinking, and entertaining presenter. He has brought all of the skills and experience from years of creating beauty to the Jersey Shore, where he and his wife have chosen to raise their 2 children. Dr. Fred has many interests outside. He is an entrepreneur, speaks fluent Spanish, has studied film, performs regularly as a percussionist, and is an aspiring novelist. Today's webinar topic is exposure and aging skin, the damaging truth. I am pleased to introduce our host for today's webinar, Dr. Fred Coville.
Thank you for that. Pretty nice. Thank you, Noelle, and thank you for having me. I am very, very excited to be here. Is the sound okay? Because I'm getting a little feedback. Yeah? Okay. Anyway, okay, are we okay now? Yeah. Yes. Thank you for having me, and I'm very, very excited, and I'd like to welcome everybody that's with us today. It's a real honor to be here, and I'm looking forward to spending a little bit of time with everybody. Today we have some pretty interesting things to talk about, and I'm going to get started. What we want to do here today is really go over how the sun affects us. Sometimes we take it for granted. Some of these things that we're going to talk about may seem a little bit basic. Some of them are a little bit more advanced, but I'm hoping to make it interesting for everybody that's in attendance. So let's talk about like exposure and aging skin. So, as you heard, I was privileged for many years to have lived and practiced in the beautiful British Virgin Islands. Right up here is the clinic where I worked. That was the Bougainville Clinic. And in addition to spending some incredible time with some beautiful people in a wonderful community, it became, my second home. I found that I had been exposed to people from all over the world who came to visit the beautiful islands, and I did become somewhat of an expert, without even realizing it, on the effects of the sun and the environment on skin. And so it's there that I realized how little I had learned in my training regarding skin, and how much I had to learn. And it was a wonderful experience. I miss those islands very much, and I miss the people there. But I've taken the knowledge that I learned and have applied it both in Europe and now back in the United States, where I practice in New Jersey. So, we love the sun. The sun is good for you. Everybody loves the way it makes us feel. And it does some incredible things for us in a positive way. We couldn't live without the sun. And on a physical level, it helps us make vitamin D. It keeps us warm in the winter. Nourishes the planet. It can prevent and treat some forms of depression. It can lower blood pressure. And it can even lower your cholesterol and increase normal hormonal functions. So those are just some of the many, many good things that the sun provides to us. The damaging truth, one of the many that we'll discuss today, is that UV light damages all human skin. And I really want to emphasize the fact, because there are a great many people that think that because they have darker skin that UV light doesn't do anything to damage their skin. But the fact is that UV light, which comes from the sun, damages all human skin to some degree. And all colors of skin get damaged. Here we are with Will Ferrell on the left. And it really doesn't matter how dark you are or how dark you think you are. People express damage in different ways. Sometimes it may be some discoloration. Sometimes it may be redness. Sometimes it'll be in the form of peeling or hyperpigmentation. But there is an effect that is negative from too much sun exposure. So why do we even have skin color in the first place? Why are we blessed with all these beautiful shades of skin color? Well, we used to have hair to protect us. That's the way we evolved. We had hair to protect us from the wind, the sun, the rain, and that was how we started. However, over time we evolved and we lost our hair. Well, some of us still have it. But we lost our hair, and then we were faced with the fact that we were essentially naked to the elements. So skin color is really an evolutionary response that happens in order to protect ourselves from the damaging rays. We had to develop cells that produce a substance called melanin. Now that melanin absorbs ultraviolet rays. That's how it works. It disperses some of the, absorbs the rays, protecting the fragile DNA of our skin cells. So without that, we would have absolutely no protection from the sun. So that protection can protect us somewhat from developing skin cancers. So here's a little diagram about UV light. Now, I'm not going to go into too much science today, just enough so that we get a handle on this, but I do want you to understand that there are basically two main types. There's three, but two main types of ultraviolet light that we talk about. There's UVA, which penetrates very deeply. It goes straight through to the dermis, and UVB, which penetrates less deeply. However, the skin cells that both of these rays will affect are very, very important to our skin. UVA is really essentially the aging ray. So if you think of UVA, the A goes for aging. So UVA will cause a lot of the damages that we see in terms of wrinkling and old age that we associate with overexposed skin. But UVB has the majority of mutagenic rays. These are the ones that can affect our DNA and can essentially cause skin cancer. So the sun's rays would simply penetrate your deeper cells and destroy your DNA if it wasn't for melanin that serves as a barrier to absorb some of those rays. You probably wouldn't survive long enough to bear children and pass on to your DNA if you had no melanin. And that's just not how evolution works. Evolution wants us to survive. Our evolutionary task, so to speak, is to pass our genes on from one generation to the next. So that's how we develop melanin, in order to protect us from the environment. So melanin is made by these things called melanocytes. Now, I don't want everybody to freak out about science, because we're going to get out of this pretty soon. But if you see these dark bits here, these are the melanocytes, and they create this melanin. So melanin also gives us our skin color. It protects us from UV rays, and it shields the deeper cells and the tissue from DNA damage to the cell nucleus. Now, dark-skinned people produce melanin all the time. They tend to have larger melanocytes, but they produce melanin constantly. Light-skinned people, however, produce it as they need it. So that's why you see when you go out, if you're a pale-skinned person or a lighter-skinned person, you will get tan in response to the sun, because you're triggering your skin to make melanin in response to that injury. Dark-skinned people show less of that response because they're making melanin all the time and stay darker. However, they will get tan as well. It is just not as obvious. So everybody loves the sun. We know that. But the damaging truth is that all of these sun exposures, this is a picture from where I used to live, and you see this all the time in the beginning of nice weather, sometimes in the early spring or early summer. As soon as there's a day where it's not raining, everybody will rush out and go to the nearest park, sometimes with reflectors, and you'll see a lot of pink bodies out there, all of them trying to gain as many rays as they possibly can catch. And you see this all over the world. And what happens is that little bit of sun exposure, even if it's for a day, will cause damage. And especially that early summer sun, especially when your skin has not produced melanin in response to the sun, you're going to be much more vulnerable to damage. And that damage, by the way, is cumulative. We're going to talk more about that. So it's not like, you damage your skin once, you get a burn, and that's the end of it. The sun's damage is a cumulative effect that you will sort of bank over the entire course of your life, saving it up for the day when you're going to develop a nice little skin cancer. So all sun exposure results in some UV impact. And regardless of what you think, a tan doesn't protect you. I see this all the time down here in the Jersey Shore. I still don't understand it, but people love to think that that looks good. And I'll tell you a little secret. The fact is that after the age of about your late 20s, maybe your early 30s, those dark tans just don't look as good as you think they do. They, you may think that they look spectacular, but the fact is after a certain age, your skin just can't handle it, and you begin to look a little more leathery and not quite as attractive as some of us like to think. So a tan doesn't protect you. Here's a woman with a, I don't even know if you want to call that tan, or maybe it's just char. A burn doesn't protect you. I know people that actually say, well, Doc, I got my first sunburn, so now I'm good. I'm good for the summer. No, a burn does not protect you at all. And glass doesn't protect you. Glass will prevent some of the ultraviolet, the UVB light from passing through, but UVA, the aging rays, will continue to pass through. Now, this is a picture of a gentleman who was a truck driver for about 15 years. The left side of his face, which was exposed to the sun as he was in the driver's side of the car, was constantly exposed to the sun, even through glass. And he has severe damage on the left side of his face. The right side, having received much less of that UVA ray, didn't get as much damage. Now you can tell, by the way, remember I said that the UVA are the aging rays and the UVB are the cancer-causing rays. Now I don't see any lesions on the left side of his face. This is the left side of his face, the right side of your screen. So we don't necessarily see any early skin cancers. At least I can't. I'm not examining him, but from here I can't. But what we do see are the effects of the aging rays, and that makes perfect sense because he would have received UVA rays through the glass of the car, even when his windows were closed, and those are the rays that cause the aging effects. So being doesn't protect you from the sun either. There's Clint Eastwood. He's actually looking pretty good, but you can see how his skin has aged, and those were years and years of those Western films, and a very pale-skinned individual. So up to 90% of all the visible skin changes that we attribute to aging are caused by sun exposure. The fact is, if you go to England, where I did have the privilege of living there for a while, and where there is not a tremendous amount of sun all the time, you'll see people that are well into their sixth and seventh decades of life that have never really had big amounts of sun, and their skin looks pretty good. So most of the aging that we see is related to sun exposure, and everybody, regardless of race or ethnicity, is vulnerable to that. Now, you may have seen this little video before, and I think this is a pretty remarkable thing. Now, this is a slow version. I'm going to speed it up a little bit. But what we see here is someone aging from the time of childhood, and they're going to go into their later years. So I want you to look. Now, there are going to be some effects that we're going to see that have to do with the structure of a face, and that's a topic for another talk. But there's also going to be effects that happen to the skin. So as you can see, she's starting to develop into a more mature individual. The shape of her face is changing. The subcutaneous fat, and she's developing some higher cheekbones, things like that. But as we advance, we can see what's going to start happening. She's probably in her teens around here, and as you can see here, she's starting to develop some increased sebaceous activity, meaning oil production. She's starting to develop some changes. This may be associated with someone in her teens. And as we go forward, you see the texture is starting to worsen. She's starting to get some visible pores. She has more oil production. Maybe she has the odd breakout now and again. Now, in response to exposure, you can see she's starting to develop some pigmented areas, right? Regardless of what skin type, she's obviously of Asian descent. But you can see texture is worsening. Skin is becoming laxer. The distance from her eyelash down to where her cheek begins is increasing because the skin becomes laxer. Okay, that is also related to exposure. And you see how she's starting to have some darker areas. We're going to speed this up just a little bit more. Now what's starting to happen is you're starting to see some other changes. Here's some early wrinkling. She's probably early 40s, maybe going into 50 soon. You can see some fine lines. The shape of her face is changing a little bit. She's advancing pretty quickly now. Shape of her face is changing because we have some bony absorption, but also skin is starting to hang a little bit, and it's making her more oval and almost square because the skin is starting to hang off of the bony structure. Skin is getting tougher. There's deeper lines, bigger visible pores. You see how hollow her eyes are becoming. Lips are getting thinner. This is no longer that little girl that we saw just a few seconds ago. And most of these changes are due to exposure. Now we're going to keep going. Now obviously there's some hair changes, and we continue to see more skin changes, and she's aged probably her 60 or 70 years in just a matter of seconds, and more pigmentation. Okay. So we've seen how someone ages, and that's sort of a disturbing little video, I think. I don't like to admit that those things are happening to me as well. So how do we see health in youth? Well, we just had a good clue to that. We saw that little girl age very quickly in a very short amount of time. We judge health in youth more than we realize simply by the condition of our skin. When you see someone walk down the street, obviously you have Brad Pitt here and you have George Clooney, and Brad has his shirt off. We know this is a young Brad. First of all, he's got a six-pack, which he probably, I don't know if he does anymore, but you can see his skin is a youthful skin, and that's how we see health in youth. Skin covers the entire external surface of our body, and it's the principal site that we interact with the surrounding world. This is the way we connect with our world. However, we don't share our entire body with the entire world. But our skin, it's sort of the most expressive organ we have, and it serves us in a lot of different ways. And it acts as a billboard that sends messages about who we are to the world around us. We send messages in our skin in many, many different ways. And we've been doing this a long time. I love this picture. This is Otzi the Iceman. Now, this is a gentleman who was found in the Alps in the early 90s, and he is over 40,000 years old. Now, they found him, his skin was preserved, and the most striking thing about him was that when they examined his skin, he had tattoos. He had tattoos 40,000 years ago, long before any recorded history. So we've been adorning our skin, using skin to express ourselves and using skin to say something about us since time began. And we still do. We still do. Because the rest of us get messages about who we are from the skin that is exposed. Now, because we tend to live in civilizations, the only areas of our skin that we see for the most part are our face and our hands. Everything else that you see is hair, makeup, clothes, things that don't make as much difference. But the skin of our hands and our face tell tremendous stories about who we are and about our experience in the world. So when we see a face like this, we don't know who this woman is. We don't know anything about her. We don't know if she's rich, if she's poor, if she is a maid, if she has maids. We don't know anything about her. But we do know that we can make up a story about her just based on the condition of her skin and the damage that it sustained. And we see a life's worth of emotions right on her face. So when we talk about foundational beauty, I will always, when I see patients in my plastic surgery practice, I will always first start from skin, because if there's nothing else that I can improve, if I can work on your skin, then I can surely make a difference in the way you present yourself to the world. So foundational beauty begins with skin. Skin has an emotional quality that we see. Beautiful skin transcends just about everything else. So like I said, I will always start with skin if given the chance. People come in and they say, Doc, I need some filler, Doc, I want a facelift. But the fact is, whereas I can do all those things, we can transfer all kinds of fat to your face and do things like that, but unless you have good skin, you're never going to achieve a truly foundational beauty. Great skin, when it walks into a room, makes everybody stop and stare. And here's a patient. We just did this in this woman, lovely woman in Holland. She came in with a lot of sun damage. Now, all that was changed on her is the condition of her skin. So there's no Botox, there's no fillers, there's nothing else, just better skin. And you can see what a beautiful impression that makes. Now, if we did other things on her, sure, there's plenty of things that could be done. But just by improving the quality of her skin, and this was done, by the way, with Zeo products, and deep chemical peel, the controlled depth peel, which I was fortunate enough to perform on her in Holland. So, any skin that damages easily, sorry about that, skin that damages easily ages easily. So when you see fair-skinned people out in the sun, like I said, those effects are cumulative. And that damage, if it starts at an early age, will show itself at a later age. Now, again, a sunburn is a radiation burn. Please don't romanticize a sunburn. It's not something cool the kids do. Oh, I got so red, I got tan. You didn't get tan, you got burned. And it is a radiation burn. This is from ultraviolet light. This is akin to receiving radiation and burning your skin. This is nothing to laugh about. And this burn is severe enough that it may have effects well down the road. So here's this gentleman again. So what does UV radiation do? Well, UV radiation has harmful effects on the skin that accumulate over time. Both UVA and UVB are linked to skin cancer. UVB rays will impact the surface of the skin. They'll cause sunburn, and if they penetrate deep into the skin, they will contribute to So again, the UVB rays are the ones that are mainly responsible for both melanoma and non-melanoma skin cancer, and they are the most biologically potent in terms of overall short-term and long-term consequences. So they'll have immediate consequences, but also long-term consequences. They're responsible for skin tissue damage, and they're partially absorbed by the ozone layer, but not much. Now, in our environment, we're losing our ozone layer, so we're becoming more and more bombarded by these UVB rays. The ultraviolet A rays penetrate much deeper, as we saw from that earlier diagram. They're strongly absorbed by the melanocytes, which is a good thing. But UVA contributes substantially to the chronic sun damage and wrinkling that we see as we get older. So, environmental and aging effects on skin. There are wrinkling, pigmented blotches. You start to see sagging, yellowing, dryness, leathery look and texture, and sometimes you see growths. And that's all from exposure. Nothing else causes that, just exposure. Other things that you can see are freckles. People always say, oh, I look lovely, I have freckles. Well, some of these freckles, most of these freckles, they're not, angel kisses. They are sun damage. So freckles are small little spots that show up only in some sun-exposed areas. If you look, her chest is not as damaged as her face is because she shows her chest less. They're benign, they're not malignant, but they won't turn into skin cancer. They're usually light to dark brown, and they're common in the very light skin types. They usually start from early childhood, and they will fade if she stays out of the sun. Sololentiges, these are the skin spots or the old age spots that people see. These things, some people call them lentigos, old age spots, some people call them liver spots, and they're tan or brown or black. They are found in 90% of the white population older than 60. Sometimes they can be found in younger individuals if you've been living in a sunny place for a long time. They persist for life, although there are many things that will get rid of those, including some topical treatments, lasers, chemical peels. They can darken in the summer, but they will not fade away completely in the winter. But they are not early skin cancer. Melasma is something that we see a lot of, especially in a practice that where we deal with skin. Women and men come to us complaining of these darker spots, and these are different from those spots that we just described. They also can be called chloasma. We see them a lot in women because they are related to hormonal changes. And there is an increased prevalence in people who are Hispanic, Asian, or of African descent. We'll see some pictures like that later. The most common location is the face and then the forearm. Telangiectasia, those are those spider veins, and those are believed, and then people think, oh, it's because you're a drinker or you have rosacea, but a lot of these are due simply to sun exposure. Actinic keratoses, these are these sunspots. They tend to be flaky. They tend to be these chronic things that as people who've been in the sun a lot develop, and these things are pre-malignant, and they can develop into a squamous cell carcinoma, and so they should be treated. So that brings us to skin cancer. And that's the thing that most of us are afraid of. Skin cancer is one of the most common forms of cancer in the U.S. and around the world. In the United States alone, more than 2 million cases of non-melanoma skin cancers are found. And the most serious of all skin cancers, melanoma, will cause over 70,000 of skin cancer each country. In places like Australia, New Zealand, even more. Nearly half of all skin cancers in the U.S., nearly half of all cancers will be skin cancers. So when I talk about non-melanoma skin cancer, what am I talking about? I'm talking about the basal cell and the squamous cell carcinomas. Those are ones that your doctor, your dermatologist, or your plastic surgeon, those are the ones that you will have a skin check for. And most of the skin cancers that you see are called non-melanomas. And that's a good thing because nobody wants melanoma. But most non-melanoma skin cancers developed on the sun-exposed areas of the body. So those are the ones that show up on your hands, your face, your arms. If you work outside, maybe your back. They'll be on your lips, on your ears. They can be fast or slow growing. There's no rules about them. But the nice thing about them is that they rarely spread to other parts of your body. So when we talk about things that size, both basal cell and squamous cell, although they can, it is rare that they do so. They take a long time to do that. So typically they don't metastasize, and they're rarely fatal. Now, is it impossible for? No, I've seen patients that have had numerous basal or squamous cells, and they will cause some very serious conditions, including death. But melanoma is the big baddie, the one that everybody is very worried about. And that begins in the melanocyte. That's the very same cell that produces the melanin that protects you. If the DNA of that melanocyte is changed by chronic ultraviolet light exposure, you can have a chance of developing a melanoma. It is much more fatal. It kills 1 in 4 people that develop it. So, basal cell, this is what they look like. They generally are somewhat pearly and raised, but there's so many different types, and that's why you have to have a skin check so that you make sure that the lesion that isn't healing, that isn't going away, is not a skin cancer. But basal cell is the most common. It is also the least aggressive, which means it doesn't spread. However, it can be very damaging, and it can spread locally. So especially a lesion like this, which is very close to an eyelid, can destroy a lot of the eyelid and needs to be taken care of. So people with fair skin, blonde or red hair, and blue or green eyes are at the highest risk of developing these basal cells. So they start out, usually most patients that I see come and they say, Doc, I have something that just won't go away. I've had it for 6 months, I've had it for a year, and it bothers them. But they're not sure what it is because, as I said, they can present themselves in many different ways. But they do tend to grow very slowly and almost never metastasize. But the cure rate is over 95% if we get it early. Left untreated, though, it can really cause a bit of damage and disfigurement, especially if it's on an area like the nose or, like I showed you before, on the eyelid or on a lip. Squamous cell is a bit more aggressive than basal cell. And most of them come from those actinic keratoses. Those are the lesions that your doctor will say, oh, that's just an actinic keratoses, we'll just shave it off. However, if you leave those alone, these things can develop into a squamous cell carcinoma. They also show up in sun-exposed regions of the body. Again, people with light skin, light hair, and light eyes are most likely affected. They don't show up as that pearly raised lesion, but really as red scaly patches. And again, the cure rate is over 95% if you get it early enough and small enough. Here's a patient I just saw recently, actually, and he came in, and this had been around for a very long time. This is a squamous cell carcinoma, and he was afraid of coming into the doctor because he had had a skin cancer several years earlier, and it was on his nose, and they had to take off a large portion of his nose and reconstruct it. So he was very reluctant to come back, and you can't sit with these things. you have to treat them early. So he let it go for over a year and a half, and then came to me. And if you notice here, yes, he has this lesion here, but it extends already to here, underneath the skin. So I had to take off this entire area, and luckily we were able to give him a nice reconstruction, and he did very nicely, and he was very happy. And there was no more skin cancer on any other part of his face. Now here's the elephant in the room that nobody wants to talk about, the malignant melanoma. Now, unfortunately, the incidence of melanoma has increased over the last few decades, and it's not because we're picking more of them up, it's because we are getting more and more sun exposure, and our ozone layer is changing, so we have less protection, and people, unfortunately, are not good enough about avoiding sun. So, again, it's more predominant in Caucasian skin. It's less common in deeply pigmented skin, but it's not absent. So the difference with melanoma, however, it's not usually associated with people that have a lot of sun damage. It is associated with burns. So if you get bad sunburns over time, then yes, you have a higher incidence, but it's not the kind of person that you see that is very weathered looking generally. So when we talk about melanoma skin cancer, there are things that we do talk about. The A, B, C, and D are things that you really do need to understand, and I'll go through them very quickly, but this information is available very easily. The first thing you look for is asymmetry. So basically, if you mentally cut a lesion in two sides, you'll see that one side doesn't match the other. That's asymmetric. An irregular border like this, that is something that is suspicious. Varied color, so it's not just one color, it's a mixture of colors, and diameter larger than a pencil eraser is generally considered to be something that is suspicious. So you look for the ABCDs. Now, the thing is, these things can happen anywhere. They don't have to be on sun-exposed areas. It can be on the soles of your feet or your back. So generally, you have to have someone else take a look for you. So if you are at a risk, then you should have yearly skin checks by an experienced physician that understands what to look for. And you can also have your significant other take a look at you. And now with digital cameras, it's very easy for you to take a picture of a lesion, and if something changes, you can see that over time. And I use that tool a lot with my patients. Now, as I said before, melanoma is almost always curable when it's detected early, and although it's most common in Caucasian individuals, darker skinned people do get it. Bob Marley, who is a legend, has actually passed away from melanoma. So it does happen. So how do we take care of your skin? Well, there's some basic things. You want to use a skincare regimen that'll restore, heal, or protect your skin, and I'll tell you about this. I mean, I've been a fan and a student of Dr. Obagi for well over 20 years. I've used his products exclusively on my patients, both the original formulations and now the ZO formulations, which I honestly believe are the best products available on the market. There simply is nothing better, and we're going to see some of that in a little bit. So ZO products, if you want products that will work, those are the ones that will. You need to drink plenty of water every day, and nobody does enough of that. You really need to hydrate, and when you shower and bathe, keep the water tepid, not too hot. Heat will harm your skin. Use a sunscreen. Even on the days when you think the sun is not that strong, you really do need to use a sunscreen. And include healthy foods and oils in your diet to keep your skin healthy from the inside out. So I've always believed, and like I said, for the past 20, 25 years, I've always believed that any aesthetic procedures, so if you're going and you're getting anything done, then you should be on skincare first. It's just that basic. I mean, you know, you can have all the Botox in the world, you can do all kinds of things, but if you don't have good skin, you're just not going to look that great. And I mean, I see patients day in and day out that come in and they've had 2, 3 facelifts, they're loaded with filler and all kinds of things, and their skin just looks horrendous. And I just say, you know, enough. Just stop a minute. Let's get your skin looking good, and you're going to be amazed at how much better you look and how much better you feel about yourself. So the cornerstone of therapy, the cornerstone of anything, is a good scientifically based skin preparation and skin care. And again, as I've said, I've used the Zeo skincare line because I believe it just simply has his finger on the pulse of this. He gets it better than anybody else, and luckily enough, he's passed on that information to people like me. So there's a Zeo medical line, and I'm not going to go through all the products because there's plenty of them. And there is the Zeo Skin Health line, and I use a combination of both of these. And every patient I see basically is a skincare patient. Every patient that walks through my office, whether they're coming in for a liposuction, a breast augmentation, or a facelift, starts with skin, because that's where true beauty starts. So when you walk into my office, you'll see a display, and there's my Fred water, but you'll see a display of products, and they're available for anybody because I truly believe in them, and you'll notice that they are the only products that I sell. So what is the art of sun protection and skincare preservation and skin rejuvenation? What's the secret? Well, the secret is pretty much the first part of it is just paying attention. You know, you have to pay attention to your skin. You can't have beautiful skin without paying attention. That means you have to wash your face. You have to protect your skin. You have to reverse some of the damages. You have to exfoliate. You have to get rid of the old skin so that new skin can come in. When you have anything that you're worried about, you need to ask your doctor about any skin changes that don't improve. If they're bleeding, if they're growing, if they're itching, if they're just not going away, well, you need to get it checked out. So good skin care. So you need, again, like I said, sun protection, gentle cleansing. Exfoliation is one that I didn't write on here, but exfoliation means getting rid of the old stuff so that you stimulate the new stuff. Protecting yourself from the sun. Protecting yourself from the sun doesn't just mean lathering yourself with sunscreen, although that's a great thing. But sun protection also means sun avoidance. You know, when I first moved to the British Virgin Islands, I was invited to a wedding, and you know, I was excited because, God, I'm living in the islands, and what a wonderful place. And I remember it was a wedding that was on a beach, and I looked around, and all of the people that were like me, that were visitors to the islands, were sitting there right in the middle of the sand, baking, red-faced and sweating, and all the people that had lived in the islands for a while was sitting under the trees, comfortable, and in the much more comfortable, but they also were protecting themselves from the sun. And we tend to do this. We tend to see sun, and especially if you live in an area where you don't get it every day, you tend to just run out there and say, you know, bathe me in your rays, when in fact, you know, you might as well be jumping into fire. You really do need to avoid the sun or protect yourself from the sun as part of taking care of yourself. When you use a sunscreen, you need a broad spectrum sunscreen with an SPF of at least 15. Don't go up. There's so many chemicals in there that you're not going to get anywhere with it, and it's going to probably do some damage. So you don't really want to go above 50, but generally in the 30 to 40 range, most sunscreens, especially the ones from Zeo, will be great protection. You need to use a sunscreen, by the way, that has a UVB protector like octinoxate, and also a UVA protector. And a UVA protector, again, like I said, you know, UVA penetrates deeper. You need a metal in your sunscreen. So that can be zinc oxide or titanium oxide. And think of the metal like a suit of armor. It just reflects those rays off. So you need a sunscreen that has both UVB and UVA protection. And you need to seek shade. And try to avoid the sun between 10 and 4 when the sun rays are strongest. Wear protective clothing if you're going to be out for a long time. If you're very sensitive to the skin, then you really should invest in some outfits and some level of clothing that will protect you more than standard clothing. You know, it's all well and fine, you know, to wear a T-shirt, but if you're a very fair-skinned, freckly redhead, and you think that your T-shirt is doing the job, well, you're sadly mistaken. You know, the sun's rays, especially in very sunny places, will penetrate that. So some people, you know, need to invest in some of the laundry detergents, which will which can give your clothing a little bit of sun protection in addition to the sunscreens that you need to use. Smoking, come on. I mean, nobody should be smoking anymore. I mean, we know how bad it is for you. There's no mystery here, you know. Smoking makes your skin look older, contributes to wrinkles. It narrows the blood vessels, so it damages the fibers that give your skin its strength and elasticity. You know, you can always see a smoker's face. It's so easy to see the damage that smoking causes. Plus, it makes you make funny faces, which contributes to the vertical lines by your lips. So if you're a smoker, the best way to protect your skin, even more than sunscreen, is to just stop smoking. I mean, you really have to. There's just no reason for it anymore. You need to treat your skin gently. You need to cleanse, you know, and sometimes these things can have a toll on your skin. So limit your bath time, avoid a lot of strong soaps, use proper products on your skin. Give yourself that chance to really heal your skin. Eat right. The right fruits, vegetables, and oils are very important for your skin. And stress. You know, there's an easy thing to say, but limiting your stress will make you feel better, help you live longer, and will improve the way you look. An interesting study was recently done where they put Botox head-to-head with Prozac in terms of treating depression and stress. And Botox actually won. Botox has more of an effect on it as an antidepressant and a stress limiter than Prozac does. And the reason for that is partly because when you can't make those wrinkles in your face, when you can't move your brow in those areas, you actually feel happier. And happy is good. We like happy. Happy makes you feel good. So, as I said, people come to me, they want to look better, and sometimes they come and they say, I think I need some Botox or I need surgery, but I always start from skin because that's what's going to make the biggest difference. So here's a young lady. She's got hyperpigmentation acne, and the hyperpigmentation is partly from the acne, but in products. Very light three-step peel, which any of your ZO providers can. Looks pretty spectacular in a very short amount of time, and she's very, very happy. Here's another woman. Now, I saw her. I met her in the Netherlands, and I never saw her again until 2 years later. And here she is after that one peel. She'd never had anything else except for that one controlled depth peel. So getting your skin healthier can make a world of difference. And there's no Botox, no fillers, no surgery, just a chemical peel where she was resurfaced and the skin was able to shrink down. Here's another young lady, again, oily skin, hyperpigmentation from the sun. And she's a very pretty girl, but you don't even notice it because all you see is a complexion. After about 2 months of some very nice, a nice ZO regimen, and I did a three-step peel on her, and she's gorgeous. And the fact is that she walks into a room and people look at her and they see her skin. She looks healthy, she looks young, she looks vibrant. And that makes all the difference in the world. Instead of seeing someone who, yeah, she's cute, but she's all broken out and she looks tired and oily, and here she looks much more healthy. Gentlemen as well. This is melasma and hyperpigmentation from chronic sun damage, and you know his face almost looks dirty. After a couple of months, chemical peel and some products, he looks so much better. And he's much happier. Here's a young lady who presented. She actually she came. She's actually my family babysitter, and she was broken out. And I said to my wife, I said, we can't have a babysitter with a complexion like that. People will talk. So I just took care of her, and in a few short weeks, she looks so much nicer. So you see that just taking care of your skin, just doing the right things, just limiting your exposure and doing the right things can make a huge difference. uh, in your skin. So what else can you do? Well, here's a little video that some of you have seen, and this is taking people's pictures with UV ultraviolet light. So an ultraviolet light can pick up damage under your skin. I sped this up so that we don't have to go through the whole thing, but you can see that things like freckles and dark spots and sun damage that you can't see to the naked eye can show up with the UV light. And we also see that in some people, healthy skin, there's nothing else there. So your skin ages with the sun very rapidly. Beautiful skin. There's not a mark on it. So when you see sunglasses, you look at, but I want to show you here, what does sunscreen do? Sunscreen absorbs the ultraviolet light. So to protect yourself from the sun, and you use sunscreen, you're protecting your skin. You're preventing that DNA damage that we talked about. You're letting yourself be as beautiful as you can be. So that's it. See, here she is, and you can see all of that damage that's underneath her skin. So that's it for our presentation about sun damage and how to protect yourself. And I would love to take some questions if anybody has any questions for me.
Thank you so much, Dr. Coville. We've actually collected 3 questions. The first question was, how can I help prevent sun damage to my children under the age of 10?
Well, that's a great question. And as I mentioned before, you do need to be working on sun avoidance. So under the age of 10, you know, your kids, I mean, we live at the beach where I live, and in the summer, you know, my kids are out there all the time, and I have little kids, you know, 5 and 7, and my kids are fair skinned. So when they're at the beach, for the most part, they're wearing a rash vest, so they're wearing, you know, a shirt over their skin to protect them. So the first defense is going to be sun avoidance. We've taught them how to use hats. You know, sometimes it's a job keeping their hats on, but rash vests and hats, you know, they can be cool now. Kids like them. In Australia, they have a program called Slip, Slop, Slap program. So you slip on a T-shirt, slap on some sunscreen, slap on some sunscreen, and slap on a hat. And that has decreased the rate of skin cancer in Australia by more than 30%. So sun avoidance, and then picking the right sunscreen. And the best sunscreen, as I said, is going to be something with a metal, like a titanium or a zinc oxide. And also, it should have a good UVB protector. Now, octinoxate is a beautiful UVB protector that is safe for children. Some of the over-the-counter preparations that you're going to see have all kinds of chemicals, which are not really great to give to children. So you really want to use a good sunscreen. And as I said before, Zio has some lovely sunscreens that are available that you can use on your children as well.
Thank you, Dr. Coville. Second question is, so what if I did go in the sun and I did get a burn? What are some treatment options that you would suggest that I use to counteract the damage in the short term?
Okay, well, first thing is get out of the sun. I can't tell you how many people get burned, and the first thing they do is, you know, maybe they're on vacation, or maybe it's the summer, and they'll go out again, and they'll go out, you know, maybe they got a mild burn the first day, and then they'll go out again, totally exposed, and burn themselves even deeper. So please turn off the light. If you're burned, limit your sun exposure. Sit under the shade. But as far as what you can do to the area, this is a burn. All right, so it has to be treated as a burn. If you see a burn, sort of like the one I showed you, where there was actual raw skin, well, that skin needs to be protected. If you have a blister, Don't break them. What I like to do is sort of puncture a blister and let the fluid come out, and then leave that blister sort of skin on top of the area so that it acts like a, a dressing. It's a biologic dressing. Um, Depending on how deep it is, you might have to use a burn cream like a Silvadene, but if it isn't that deep, then you want to use something that will soothe and moisturize the skin, because you have damaged the skin. So that is a place that we do use moisturizers. I don't think you need antibiotic creams very much, but you do need to moisturize. You can use things like aloe. Aloe is very soothing. Um, and you can use some very simple plain moisturizers on the area to help heal it. Don't use anything with a lot of chemicals or perfumes. Um, you want to stay very simple until your skin is healed. And then, as I said, you really do need to avoid further exposure.
Thank you, Dr. Coville. And then the last question that we had was, we're hearing a lot lately about high energy visible light. Can you kind of expound on what that is and how you can protect against it?
Well, high energy visible light is just that. It's light that you can see, and the visible light is associated with heat. So there's two things that are happening there. There's the heat from the light, as well as the the ultraviolet rays that are in there. So the visible light will transmit heat along with it. We use some of those high energy visible lights actually therapeutically in the treatments that we do with some of our intense pulse light treatments. But basically, the sun provides visible light in addition to the invisible light, and the high energy light is causing a heat injury, as well as the invisible light that's associated with it. So protecting it is going to be much more in the protecting from it is going to be much more in terms of avoidance. So shade, hats, seeking areas that aren't directly in the area of this visible light is going to be much more important. Sunscreens will help somewhat, but it basically is really avoidance of the source of the light. I hope that answered your question.
Thank you, Dr. Coville. This concludes the webinar, and we thank you for participating. If you are interested in finding out how to become a member of the ZEO Circle of Skin Health, please contact ZEO Skin Health through our website at zeoskinhealth.com. To purchase Dr. Obadji's new book, The Art of Skin Health Restoration and Rejuvenation, please visit zeoskinhealth.com. Likewise, for more information on upcoming events with Dr. Zain Obadji and his distinguished faculty, please visit the events page at zeoskinhealth.com. Finally, for private training with Dr. Zain Obadji at the Obadji Skin Health Institute in Beverly Hills, please call 866-276-2990. Thank you again, Dr. Coville, for an incredible webinar, and thank you all for joining us today.
You're very welcome. Thank you.